Nikita is a seasoned athlete. She is a javelin thrower presently selected for the national camp. She says she occasionally develops pain and discomfort on the back of shoulder. As a coach, trainer, therapist, you try to check and compare the range of motion of both shoulders. What do you think is the role of flexibility in preventing injuries in this particular athlete? If you're looking for answers to these questions, you're in the right place. Welcome to this NPTEL offered course on physical medicine and rehabilitation in sports. We are in week 6, mainly focusing on flexibility and mobility and its role in athletic performance. Welcome to today's lectures on flexibility and its role in athletic performance. With me, Wing Commander Chandrasekhar Guru. I'm an associate professor in the field from Armed Forces Medical College. The learning objectives of today's lecture will be focusing on flexibility, its importance, the factors that affect flexibility, what is its role in athletic performance, and we'll discuss certain case scenarios to understand the practical aspects of flexibility in sports performance. So to start with, what is flexibility? Flexibility is a foundational component of movement. It's the ability to move the joints through full range of motion. It is affected by muscles, joints, connective tissue and the nervous system. This is a term called mobility. What do you understand by mobility and flexibility? Let's see. Flexibility in broad terms would be passive range of motion. Passive would means application of an external force, something like gravity or a partner or a machine, to cause a involuntary activity, or rather there is no active muscular activity involved in flexibility. Whereas when you see mobility, mobility is active range of motion. The moment I say active, active includes involvement of the muscle as well as the neural component. So it's a neuromuscular component wherein there is a dynamic quality involved. I would explain it. It means that there is a neural component, there is a decision making at the level of the brain. Thereafter the signal comes to the particular joint, the receptors are activated, the motor component is involved. So you actively do a particular action. So there is active involvement of the nerve as well as the muscle. So this becomes the dynamic component, and then it's called mobility. Whereas flexibility, it is only a passive range of motion. So you can say flexibility as static flexibility and mobility as dynamic flexibility as well. So flexibility and mobility are not mutually exclusive. It is important to have both. Rather, flexibility can be considered as a subset of mobility. So both are essential for athletic performance, but they are quite distinct. So what are the factors affecting flexibility? Common factors are joint structures. Obviously, if the anatomical structure is not well integrated or it's not in the required size and shape, then it will affect the flexibility. Also, certain anatomical configuration limits movement in all other planes. Say for example, shoulder at the shoulder joint, you have movement at almost all the different planes that are possible. Age and gender is again an important factor. As we grow older, as the age increases, the flexibility component decreases. There is increased stiffness in the connective tissue. Gender wise, if you see between males and females, females are more flexible because of the hormonal differences. Muscle and connective tissue is again an important component. When inherently or genetically, if your connective tissue is slightly more extensible, so then that may lead on to increased flexibility and mobility. So again, muscle and connective tissue has an important uh, role to play. Stretch tolerance. So again, with activity, what happens is your tolerance to stretch the muscle decreases. So again, this forms an important factor in maintaining flexibility. Neural control, as we had discussed, neural control is definitely an important component in mobility, but in flexibility also is important, because we will subsequently see the physiological basis of stretching and flexibility, wherein there is a neural component in terms of the mechanoreceptors are involved in kind of maintaining the length of the muscle. So it obviously affects the flexibility. Resistance training and bulk. How resistance training affects flexibility is that when you increase resistance training, there is increase in the bulk as well. So this over a period of time also restricts the entire range of motion. Say imagine you have been going to gym and you have developed a biceps which is kind of become larger. So because of which the complete flexion will not be possible because there is approximation of the two groups of muscle. So that as such will restrict the range of motion. So accordingly the flexibility also will decrease. Activity level is again an important component. As you increase the activity level, because of the type of activity you may have, which may influence the flexibility of the individual. So these are the various factors which affects the flexibility. It is also important to understand that having a normal range of motion of joint doesn't mean that you will definitely have a normal movement, because when you say normal movement, it involves also active. So there is also movement control as well as motor control and the proprioception, which is also involved in terms of movement, whereas range of motion is more of a passive thing which is governed mainly by the muscle and the connective tissue properties. What are the benefits of flexibility training? So why we speak about flexibility in sports parlance? Because it improves the movement efficiency. When your muscle length and the range of motion are full, the chances that your movement efficiency also is better. Obviously the involvement of other components also should be considered during training. It reduces the muscle stiffness. How it is important? Because muscle stiffness as such also can result in decreased force production, so that itself is an important factor. So flexibility kind of reduces the muscle stiffness. It also reduces the risk of injury. It improves the posture and technique. So imagine you're continuously doing the same kind of activity, or you're continuously you perform certain kind of postures. Say for example, you are working in an office in a desk job. Continuously exposing to a particular type of posture can also lead to imbalance in the muscle between the sides as well as also in the posture. So that itself also predisposes you to various injuries and syndromes. So that is again an important factor. Enhanced performance. Flexibility, if the flexibility is good, appropriate for the particular sports, it means it will indirectly help in kind of improving your performance. But then there are different ways of improving flexibility training, and how it affects performance is what we are going to see in the subsequent slides. What are sport specific demands of the flexibility? When we say flexibility, it's not always that flexibility will kind of give you the extra edge or improve the performance. Excessive flexibility can reduce stability, because if it is kind of an opposite. Hence, if you have more flexibility, the stability is compromised. If you have more stability, then the flexibility is compromised. So it is important for a particular sports or a particular movement in that particular sport, a particular range of motion or the flexibility and stability has to be maintained. So too much of flexibility in an already mobile joint can increase the risk of injury as well. So the key is optimal range and not maximal flexibility. So the flexibility is again, it's not always good to have good extreme level of flexibility. It is better to have the optimal level of flexibility to generate the necessary force and the range of motion to do the particular motor movement. So not all sports require the same kind of range. Again, it varies with different sports. Say for example, a gymnast will obviously require a broader range of motion as compared to a power lifter, because powerlifting would require the range of motion to be active in a particular range only. But then in gymnast, it is important the individual need to be more flexible for performing various maneuvers. So that's the difference based on the sports. The sports demand again determine what kind of flexibility that you require. Say in case of overhead athletes like throwers or a javelin thrower, a shot put thrower, or a basketball player. So the overhead athlete require excessive range of motion as compared to another sports, like say for example a runner. So here the shoulder range of motion is more as compared to a runner who doesn't actually require a lot of shoulder range of motion. So that's the flexibility demands are determined by the sports demand as well. What about the biomechanics aspect with respect to the flexibility training? So if you see, When flexibility is limited, the body try to compensate because it's the natural progression. If your flexibility is low in a particular group of muscle, the next proximal group of muscle try to compensate for that. So that results in compensation in the ligaments, connective tissues, as well as in the kind of joint motions, as well as also in the strength generation by the group of muscles. So increased stress is there on these vulnerable areas, especially in if you see in most of the sports, it is the involvement of the lower limb. So obviously finally you will have problems in terms of the low back areas or the knees, where they generally become the low they generally become the areas where the stress gets transmitted. So it is important to also look at the flexibility component of the distal joints. Proper flexibility will reduce this compensation patterns, and it affects the force transfer as well as the joint alignment. So thereby it can reduce the injury risk. In case of a example for a sport specific demand, in with respect to biomechanics, it is important also to pay attention towards the joint angle that is required for a particular sports. So that is again the key for maintaining the flexibility in that particular joint range, which we call as kinematics. And also with respect to the kinetics, with a particular range of motion, the force generation of the group of muscle will be maximum. So it is also important to maintain that particular range of motion, so that the force generation is appropriate for executing that particular motor activity in the sports. So, for example, overhead athletes, because of their excessive range of motion in the shoulder, especially the external rotation, there are compensatory mechanisms that happens biomechanically. One is, beyond 90 degrees of shoulder abduction, it is the requirement of the scapula to synchronously work along with the glenohumeral joint, right? So, there may be disturbances in terms of the firing of the muscles which are responsible for the rotation of the scapula. So that may lead on to changes in the misfiring in the different force couple generation, and that can lead on to say injury risk later on. So it is important to also consider this flexibility aspect when we compare such sports. You can also have a compensatory reduction. Say for example, in overhead athletes, again because of their external rotation, invariably, if you see, the internal rotation is restricted. So doing a comparison between right side and the left side, you get to know how much is the kind of compensation that has happened in the range of motion per se. So finding out that difference and then kind of trying to correct that by incorporating certain flexibility training in their training program will help to reduce the risk of having excessive compensation and later on leading on to injury risk as well. So, in order to further kind of institute a flexibility training, it is always important to understand what is the flexibility level of an individual. So, that comes from assessing the individual. So, quantifying this flexibility is important to identify the imbalance. What is the imbalance with respect to the same individual if we have a baseline measure longitudinally with the training? Also you can compare with the other side, because most of the joints you have the other side, so you can compare with the other side. You can also compare with the existing normative data of the typical kind of players. Say if I need to assess a javelin thrower, so if I have the kind of normative data of that particular parameter in javelin throwers who have done well, so that gives an also a benchmarking to know what is the acceptable level of flexibility that is required. So that also helps in kind of framing your training programs as well. One of the important way of assessing is doing a sit and reach test. So in the picture this is a sit and reach equipment wherein you place it close to the wall and then try to try to bend forward and extend yourself as much as possible. So the scale there gives the reading and gives an objective measurement. So that gives the overall flexibility of the individual. You can also do it by using goniometer. Goniometer is again it's like a geometric scale with two angles, which you can move, which one will be stationary to the one end of the limb of the joint, and the other limb will be mobile along with the joint. So you can measure the angle made within the particular joint. Say if you want to measure the elbow joint, I place the goniometer here, and this will be stable. It will not move, and if I move to my extreme, so this particular arm can move, and this shows the angle, and if I extend it, and this particular angle is the extension. So that gives the kind of value. So again, this angle is used as a range of motion of the particular joint. You can also do flexibility assessment using functional movement screen, where you also will include your active component. So it will be more of doing a movement assessment. You ask the individual to do different movements. There are about 7 different movements which we have discussed in the 4th week lecture, wherein you ask the individual to perform those 7 movements and rate them in scale of 1 to 3. So maximum scale of 3 is considered normal. When it is less, then you can give some corrective action to rectify the movement pattern. So this will be more of a active correction, wherein you can use this to kind of use a passive or a stretching exercise or flexibility training. Also, you can use the same functional movement screening to also introduce some movement drills in terms of mobility training as well. So, having known what is flexibility, what is mobility, their application in sports, and how it is useful in kind of enhancing the performance and reducing the injury, it is also important to understand the physiological basis of the flexibility or stretching. So, flexibility is enhanced by stretching exercise. It's a passive component, as we discussed. So, it is again controlled neurologically. So, as we discussed in one of the factor, we said neural factor is again an important factor that determines the flexibility, right? So, there are certain receptors which are present in the muscles. One of the receptor is the muscle spindle. Muscle spindle is nothing but is again like a thin muscle filament, which is in addition with the extrafusal fibers. So, you would have studied in the course on Introduction to Exercise Physiology and Sports Performance about the muscle and its structure and function. So, in that we would have discussed that there are 2 types of muscle fibers, intrafusal and extrafusal. Extrafusal fibers are the actual muscle fibers which generate much of the bulk of force that is being generated in the muscle group, whereas intrafusal fiber has this muscle spindle. So, this muscle spindle acts, it is kind of located along with the extrafusal fibers, and when there is a kind of stretching, increase in the length or change in the length, this muscle spindle also kind of stretches and it gets activated. When this is activated, it kind of releases the excitatory signal which stimulates the alpha motor neuron. So, we know that alpha motor neuron is the one which kind of causes increased contraction of the muscle, right? So, stimulation of the alpha motor neuron will cause a contraction of that particular muscle which is supplied by the alpha motor neuron. So, this particular reflex is spinal only, it does not travel beyond the spinal cord. So, it is completed within the spinal. So, it is faster as well. So, this is a basis of the stretch reflex. This is called the stretch reflex, where in an example would be using a knee jerk reaction, wherein you tap at the patellar tendon, it causes sudden contraction and it extends the knee because of the contraction of the quadriceps, which is the extension of the patellar tendon, which is extension of the quadriceps. So, the muscle spindle helps in kind of increasing the contraction. That is what you have to remember. There is another group of receptors which are present located close to the muscle tendon junction, and this is placed here at the end of the muscle, because when the force is kind of generated, it is transmitted to the tendon, and tendon is attached to the bone, right? That causes the change in the range of motion, or that causes the movement. So, there is a receptor or a sensor, rather you can say, when the force production is more. So, it may end up in kind of avulsing, completing the tendon from the bone, right? So, in order to have a control over that, we have some sensors called as the Golgi tendon organ. So these senses the increased force production that is present, that happens in the muscle, and beyond a certain threshold they get activated. The moment if they are activated, what it does is it immediately sends inhibitory signal. Inhibitory signals are sent to the alpha motor neuron. So we know that alpha motor neuron it stimulates the muscle which is supplied by the alpha motor neuron to contract, right? Now GTO, as it senses the increase in the tension or the force production, it inhibits this signal. So because of which inhibitory signal, you will have contrary to contraction, you will have relaxation of the muscle. So the force production, increased force production causes a relaxation there, and it is a protective response just to avoid sudden avulsion of that particular tendon from the bony attachment. So that is called as an inverse stretch reflex. So these are the basis of stretching. So let's see it as we go through it. So how it is helpful in athletic performance? Say there are basically three types of stretching activities that can be considered to increase flexibility or to affect the flexibility. One is static stretching. The other type is dynamic stretching. The third one is the proprioceptive neuromuscular facilitation technique. So these are the three main type of stretching. The second lecture, that is will cover in detail about the various aspects of stretching. So let's cover the basics of static stretching. Static stretching is nothing but giving a sustained stretch to a particular muscle and then holding it at the terminal end range of motion, and it is done slowly over a period of 15 to 30 seconds. So by doing so, what is happening? So when you are trying to stretch, say for example, I am stretching my forearm. So when I am trying to stretch my forearm and hold it at the end range of motion and give a slow kind of stretch and hold it for 15 to 30 seconds. So when I am doing it slowly, a slow kind of increasing the muscle stretch causes increase in the force production. So this force production gradually increase, as we know, with the force length relationship. As the force increases with the increase in the stretch, the force increases, and this force will inhibit the or stimulate the Golgi tendon organ, and this causes the activation of the inverse stretch reflex. So this inverse stretch reflex will result in relaxation of that particular muscle. So over a period of time it is continued, there is a resetting of this GTO as well, and then it helps in increasing the length of the muscle as well. So thus a static flexibility or static stretching will help in increasing the range of motion by gradually affecting the muscle length. So how it is useful in athletic performance? So if it is incorporated as part of cool down after an activity, when you try to get back the body to its pre-session state, so you will have it will help in kind of injury prevention. So caution thing is, if you do this static stretching prior to the session, what will happen? The muscle will go into relaxation state. So you want the muscle to be activated. That's why you do warm up, right? So that it is ready to generate the force. But then if you use a static stretch in the initial warm up itself before the activity, it will end up in keeping the muscle in a lower state or a relaxed state. So that may kind of be counterproductive. So that is why it is important that you don't include this in warm up session. Coming on to the dynamic stretching. What is dynamic stretching? Dynamic stretching as a component also called as fast ballistic stretching, which we will be covering subsequently in a separate lecture. What happens in dynamic stretching is, when you're doing dynamic movement, it causes an increase in the length, right? So it increases the length suddenly, and there is fast change in the force production. So this kind of change in the muscle length, which is faster, is sensed by the muscle spindle. When it is slow, it is sensed by the GTO. When it is faster, it is sensed by the muscle spindle, which immediately kind of activate the stretch reflex. When the stretch reflex is activated, it adds on to the increased force production. So in athletic performance, where you can use it in a warm-up routine. If you use it as a part of the specific warm-up activity, incorporating certain activities which is relevant to the particular sports that is being played, or a technical drill, that can help in kind of increasing the performance. But caution is, it should be used in a proper sequence so that the right group of muscles are activated prior to the workout. So if it is not done properly or not in a controlled way, it may also end up in kind of injury, more so in terms of ballistic stretching. The third part is called as the third type of stretching is called as the PNF, or the proprioceptive neuromuscular facilitation stretching. This is a type of stretching that has been incorporated from the neuro rehabilitation technique. It involves a combination of isometric and concentric activation of the agonist along with the passive stretch. So this is found that in order to carry or conduct this particular stretch, you need a partner, and some amount of expertise is required to do the particular stretch in a proper way. So expertise is required to perform this PNF stretch. However, it is found to have good help in terms of increasing the range of motion as compared to the static stretch also. So it has wide kind of application in terms of injury rehabilitation, where you have post surgical or post injury reduced range of motion can be addressed through PNF stretching in phase 2 or phase 3 of rehabilitation. So that's since they have better results as compared to the static stretching technique. So how do you what are the guidelines to have a basic idea about the stretching program? The stretching of the major muscle groups should be done at least 2 to 3 times in a week, and the holding time for the static stretches, if it is, should be minimum of 15 seconds, can be extended up to 60 seconds as well. More the stretch, more will be the increase in the length of the muscle. Design the program as per the requirement for the sport specific demand. You can use a dynamic stretch in the warm up, you can use static stretches in the cool down session, and if you want a better range of motion in especially in an injured joint or injured muscle, then you can go for a PNF with partner. The drawback is that you need a partner to do a PNF kind of stretching. So separate stretching sessions also can be used, because they are also found to improve the cause and relaxation, overall relaxation, if multiple joints are involved. So it can be used as a recovery session as well in their microcycle training. So what happens if there is imbalance? What is the kind of injury risk? So generally, if there is especially in kind of cyclical sports, where a particular joint is repeatedly involved, that may leads on to tightness of one group of muscle or the proximal group of muscle, and that may lead on to compensation in the subsequent other regions. So this can cause chronic overuse injuries, and that needs to be addressed by proper assessment and trying to kind of compare it, as we discussed earlier, with the individual baseline or with the normative data or with the opposite side. So accordingly, necessary program has to be instituted. If it is a mobility related issue, in the form of dynamic stretching; if it is a flexibility related issue, more in the form of static stretching. So in specific sports, if you see throwing sports, shoulder is an important joint. So shoulder flexibility has to be addressed. The balance between the external rotation and the internal rotation of the glenohumeral joint has to be addressed. The kind of rotation at the level of the shoulder, generally at the level of the scapula, where generally you tend to have scapular dyskinesia between the left and the right side. So that needs to be addressed. The other important in running sports, you will have hip and ankle mobility, which can actually also cause compensation in pattern, and that also needs to be addressed. In combat sports, it is important to have overall range of motion of the body. So flexibility training has to be part of the training program as such. So what are the common myths of flexibility? Common myth is this: more is the flexibility, it is always better. Stretching before exercise prevents all injuries. It is not really true. Static stretching, if you consider, it may actually decrease the performance. So it is dynamic stretching that needs to be implemented before the exercise. Stretching weakens muscles over long term is again a myth, because it depends on the requirement as per the sports. So the flexibility is not a generic term, it has to be tailor made as per the sports demand. Specific consideration is when you should not stretch. When there is joint instability, there is an injury, and because of ligament problem, there is excessive movement at the joint, it is important not to stretch it further, and that may further compromise the stability aspect of the particular joint. If there is an acute injury or inflammation, it is advised not to do stretching, especially dynamic stretching, because that may kind of be counterproductive. You can use guided controlled static stretching in phase 1 of rehabilitation, but then that is again under supervision. Post-operative tissues, again the kind of stretching that needs to be given should be again therapeutic. So the word therapeutic is to be underlined, because again expert is required to give the therapeutic dosage of that particular technique in the sports injury rehabilitation. So let's see a case. So we started this lecture with this particular case about Nikita, who is a javelin thrower, national level player, and she occasionally developed pain and discomfort in the back of the shoulder. So the question asked was, what do you think is the role of flexibility in preventing injuries? So from the question, it is clear that she is a national level athlete thrower. So the sports stage is definitely a reasonable number of years has been spent, throwing the javelin. So there are compensation which should have happened in this particular player. So biomechanically, the sports involves overhead action. So generally in this group of people, athletes, you tend to have posterior capsular tightness because of the excessive external rotation. The scapular force couple may be compensated compared to the left and right, and also in the kind of external rotation of the joint with overhead action. And as a compensation, because of excessive external rotation, there is deficit in the internal rotation. So these are the factors that would have happened in this particular case. So it is important to assess both the shoulders in this particular individual to know what is the kind of extent of compensation that has happened or the imbalance that has happened. Stretching exercises have to be implemented, static stretches specifically to kind of relax the tightness. Cool down is the optimum time during which you can include these things, and then kind of focus more on the posterior shoulder capsular stretches. The picture shows an example how you kind of stretch the posterior capsule of the shoulder. And it is important to maintain certain amount of symmetry, considering the fact that imbalance can lead on to injury. So to summarize, flexibility in in athletic performance, static stretches in cool down reduces the injury risk. Dynamic stretches in warm up are found to improve performance. PNF stretching is predominantly used in sports rehabilitation. Biomechanical as asymmetries, because of the demand of the sports, should be addressed by flexibility assessment and training. Flexibility training also addresses the imbalances and aids in better force transfer. For those of you who are interested in further in-depth studying, so you can refer to these references. Thank you for joining. Jai Hind.